Did you? Hi, Mrs. Manzio.
Hi.
May I call you Judy?
Sure.
Wonderful. I'm Michelle. I'm your nurse practitioner.
Hi, Michelle.
Today we're going to be doing your Heent assessment. If you have any questions, concerns, pain, feel uncomfortable at all during this exam, please feel free to stop me and we can talk through it.
Okay.
Wonderful. I'm going to wash my hands here to begin. I already have all my supplies we'll need for the exam and we can begin.
Okay.
All right, so I'm going to start by assessing just for symmetry, looking at your face. Your nasal labial folds look symmetrical, which is good. Your palpebral fissures look symmetrical, which is very good. I'm not noticing any scars, lesions, anything. Nothing's overtly jumping out at me.
Okay.
I'm going to go ahead and take a look at your hair and your scalp. Not noticing any dandruff, alopecia, no hair loss. Looks good there. I'm going to palpate your head. Good, normal size, normal shape, no bogginess, definitely normal cephalic. So that's good there. I'm going to go ahead and have you open your jaw. Good, and go ahead and close. Wonderful. Okay, now what I'm going to have you do, lift your eyebrows up and down for me. Very good. Close your eyes nice and tight. Beautiful. Give me a big teethy smile. Wonderful. And puff out your cheeks for me. Perfect. Okay, so we'll now be moving on to your eyes. I'm going to start here just by kind of looking at your eyebrows and your eyelashes, which the hair looks normally distributed. Doesn't seem to be any hair loss, anything like that. So now I'm going to move on to the actual eyeball, looking at your iris, looking at the conjunctiva, looking at the sclera, which is a nice china white. We're going to do that on both eyes. Excellent. Now I'm going to palpate your orbital region. Any pain or tenderness there?
No.
Good. You can open your eyes. I'm going to palpate your lacrimal ducts. But I'm not noticing any drainage, any kind of pain or anything like that?
No.
Wonderful. We're going to move on to a few visual tests. All right, so if you can hold this card with your right hand and cover your eye. Your left eye. Wonderful. And read the lowest line you can read.
83925.
Okay, wonderful. And now let's switch.
65241.
I'm noticing a bit of a discrepancy. Is there a reason why you seem to see better in one eye than the other?
I have monovision from LASIK surgery.
Ah, okay. Wonderful. All right, so now that we've done, we would be doing the Snellen today. Unfortunately, we don't have the equipment, so it would be testing your cranial nerve number 2.
Okay.
Okay. So now here, I'm gonna just do a few assessments of your eyes. I'm gonna check your pupil reactiveness.
Okay.
Good, pupils are equal, round, reactive to light. I'm now gonna do the Hirschberg's test. If you can go ahead and look at the light for me. Excellent, I'm seeing the light at the 3 o'clock position equally in both eyes, which is good. Okay. I'm gonna test your field of vision.
Okay.
Okay, what I want you to do is cover your left eye for me. Okay, good. And tell me how many, look at my nose, and tell me how many fingers I'm holding up. 2.
1, 2, 1.
Excellent, let's switch. Okay, tell me how many fingers I'm holding up while looking at my nose.
2, 3, 2, 1.
Very good. We're now going to do the EMOMs. Okay, so what I'd like for you to do here is just kind of follow my finger and just with your eyes, okay?
Okay.
All right. Good, I'm not noticing any nystagmus, no issues with your vision there. I also want to check for accommodation. I'm going to put my finger ahead of you and I would first like you to focus on that, and then I would like you to focus on the artwork behind us, okay?
Okay.
Okay, look at my finger and now focus on the artwork. Good, I noticed the pupils dilate.
Okay.
So that's good there. And then what I'd like to do here is just, we're going to cover your eye and uncover it.
Okay.
Okay, so I'm going to start here. Look at my nose. Good. No drift, No issues there. I'm going to do the same thing on the other side. Wonderful. Okay, we will now be moving on. I'm going to use the ophthalmoscope here.
Okay.
So I'm going to have a bright light that will shine into your eyes. Go ahead and then I'm going to come forward to your face, okay? So don't be bothered.
All right.
Okay, go ahead and look at the light. Good. I found the red reflex. I'm going to follow it in. Okay, good. Now that I'm looking at that, I'm looking at the cup to disc ratio, which is 0.4. I'm looking at the blood vessels, the macules. Not noticing any lesions. Looks good. All right, we're now going to do the same thing on the other eye. Okay, I found the red reflex, following it in. Okay, good. I'm looking at all the vessels, cup to disc ratio, no lesions. Looks good. You're doing great so far. Any questions?
No.
All right, so we'll now be moving on to your ears.
Okay.
I'm going to start off just kind of by taking a look, looking at your pinna, looking at your meatus. Okay, I'm now going to just kind of touch. I'm going to palpate your pinna, palpate your tragus. I'm going to palpate your mastoid process. Okay, good. We're going to do a few hearing tests.
Okay.
Okay, so what I would like for you to do is cover your right ear. And I'm going to say 2 words, okay?
Okay.
Savannah on Saturday. Could you hear me?
Yes.
What did I say?
Savannah and Saturday.
Wonderful. Let's try the other ear.
Baseball and market.
Excellent. We're now going to do the Weber test here with this tuning fork. So what I'm going to do is make some noise, put it on the top of your head, and you let me know if you hear it go through both ears, okay?
Okay. Yes.
That goes down equally?
Yes.
Wonderful. All right. So let me get my stopwatch together. And we're going to be testing for air conduction versus bone conduction with your hearing.
All right.
Okay, so I'm going to first put it back here and then here. And you let me know each time when you stop hearing it.
Okay.
Okay? Let me know. Okay, good. Good. And that was double the time, which is expected. Air conduction is greater than bone conduction, 2 to 1. So,
Huh.
we'll be doing the other ear. Oh, excuse me. Let me try that again. Good. Okay. Okay, and we hit our double.
Ah, good.
Good. Now, I'm going to grab my otoscope here, and I'm just going to have a look in those ears. Okay, so I'm going to pull the pin up and back and move the tragus as I look in.
Okay.
Sorry if you can.
You're fine.
Okay, do you see me? Okay, so I'm looking at the tympanic membrane, which is a nice translucent gray. I'm not noticing any erythema, no edema, no lesions. My cone of light here on this right side is at 5 o'clock. So good there. All right, I'm gonna come behind you and do the other side.
Okay.
Okay, gonna up and back, moving the tragus. Okay, my cone of light here is at 7 o'clock. Tympanic membrane is a nice gray. No drainage, no lesions, no scars, no erythema. Looks good. Okay, so I'll now be moving on to your nose. I'm
Okay.
first going to just start by looking at it, nice and symmetrical. I'm just going to palpate for symmetry. Any pain there?
No.
Good. We'll grab our light again. Okay. Oops. Sorry about that. Let's get a new one. All right. I'm gonna put my hand up here and lift your nose up as I look in, okay?
Okay.
I'm looking at your blood vessels, your turbinates. They're not blue or soggy, which would be signs of allergies. No obscene drainage, no deviated septum. Same on the right side. Looks good. I'd like to test your cranial nerve 1.
Okay.
Okay, so what I'd like for you to do is close your eyes, plug your right nair, and take a smell. Can you smell that?
Yes.
What is it?
Pepper.
Good. All right, let's try the other one. These
Pepper.
are? Good. All right. So your cranial nerve 1 is intact, and you have patent nair, so that's good. All right, well, now I'll be moving on to your mouth.
Okay.
All right, so I'm going to start here just by looking at your lips. Okay. Before we move on to your lips, I'm going to do your sinuses.
Okay.
I'm going to start just kind of palpating your frontal.
Mhm.
Okay, good. I'm going to palpate your maxillary. Any tenderness with either one of those?
No.
Good. I'm now going to percuss. Good. And we're going to transilluminate. Good. Excellent. Good. So now we can move on to the mouth.
Okay.
Got ahead of myself with that smile of yours. So, I'm not noticing any lesions, no cracks, no ulcers, just kind of on your lips here. What I'd like for you to do is go ahead and give me a nice teethy smile. Good, that's symmetric. Our gums and mucous membrane is nice and pale pink, no redness, no swelling, no overt bleeding. Go ahead and open your mouth for me. Okay, I'm just looking at our Stenson's ducts, or parotid ducts, and I'm looking at the submandibular ducts, or the Winston's ducts. Good. And if you can lift your tongue up for me, I'm just looking at the frenulum, which is good and intact. Okay. Go ahead and stick out your tongue and say ah for me.
Ah.
Good. I saw the pharynx rise and the uvula is midline. I'm looking at the soft palate and the hard palate. I'm not noticing any lesions, no ulcers. And on your tonsils, there's no whiteness, nice pink, no lesions, no swelling. Okay. So that looks good there.
Okay.
We're now going to move on to your neck.
Okay.
I'm going to start by just kind of looking for symmetry.
Okay.
Not noticing any scars, lesions, anything like that. Trachea appears to be midline. I'm going to palpate it. Trachea is midline. And then I want to test another cranial nerve. If you can go ahead and lift your shoulders up against my hands. Excellent. And back down. Very good. I'm now going to come behind. I want to now assess your thyroid. I just want to take a look. I'm not noticing any goiters, no scars. I'm taking no thyroid surgery. I'm now going to come behind you to assess it, to touch it. Okay, what I'd like for you to do is kind of tilt your head down and to the right. Very good. Okay, so I'm feeling the thyroid. It's smooth, it's movable, it's rubbery. I'm not noticing any nodules. So that's good. I want to make sure it's the same on the other side. So go ahead and look down that way. Very good. Okay. I'd now like to just take a quick listen. Okay, good. I don't notice any breweries or anything like that. So now that we finished our thyroid, I'd like to move on to your lymph nodes.
Okay.
We're going to start with your preauricular and your post and your occipital. Okay, good. And your tonsillar and your submandibular and your submental your axillary cervical, anterior cervical, excuse me. Long day in the office, you know. Anterior cervical and your posterior cervical. Good. Now if you can turn your head to the left for me, I'd like to check out your deep cervical. Good. And to the right, deep cervical. Good. I'm going to do your supraclavicular and your intraclavicular. Excellent. So that will complete our exam for today. Do you have any questions for me?
No.
Wonderful. Hope to see you back soon.
Okay.